So I'm going to be talking about the patient perspective in numbers, specifically talking about the incidence of cancer, which is increasing. It's increased by about 12% since the early 90s and continues to increase. Also looking at survival rates. So survival rates in the UK show that more and more people are living longer. And that means that lots of people are living with cancer as a long-term chronic condition. The increase in incidence means that now we are in a position where there's a 1 in 2 chance that we'll be diagnosed with cancer in our own lifetime, which is an interesting statistic. Early diagnosis is really important for cancer, and in the largest cancer groups there's over 3 times higher survival rate if diagnosis is early. So it's really important to diagnose patients within stages 1 or 2 of cancer as opposed to stages 3 or 4. There's a number of things influencing early diagnosis. It's really important that patients do screening. Now, only a small percentage of patients are diagnosed through screening, but when they are, it's at early stages 1 often. A large proportion of patients are diagnosed through emergency route, and if they're diagnosed with that, it's much more likely that there'll be stages 3 or most likely stage 4, and therefore survival is much less likely and much shorter. There's a number of factors that influence that. So we are lagging in the UK compared to other developed nations in terms of our survival rates. So other countries are doing better than us. There's various things that affect that. So just as simple as getting a GP appointment can be one factor. But also once you get a GP appointment, there's evidence to suggest that GPs in the UK are less likely to refer than in the other countries that we compare ourselves against. And again, a number of factors in that. There are examples where GPs have referrals pushed back to them, even when they suspect cancer, because they're deemed inappropriate. But also genuine concern that the health system won't be able to cope with increased referrals. So that leaves us at the position where we aren't performing as well. But within CRUK, we're really focused on achieving some better outcomes. So by 2034, we want to see 3 in 4 patients survive cancer for 10 years or more. And to achieve that, we want to see 3 in 4 patients diagnosed in early stages 1 or 2 by 2034.